Hi everyone, greetings from National Skills Network. This is Madhuri, and as you must have followed us on our YouTube channel or watched some of our videos, we have been featuring experts and leadership team members from various industries. And this is mostly to create awareness about the potential for employment in various industry sectors. And today we have with us Mr. Vaibhav Tiwari, who's the co-founder and CEO of Portea. And we are going to discuss a very important industry and the care economy, which is emerging with a lot of opportunities for jobs. And also it has the potential to close the gender gap. This is what ILO also says about care economy. And Portea has been into caregiving services in the medical sector for a very long time. So let's get started by asking Mr. Vaibhav about how this hospital to home kind of a medical care is assuming a lot of importance. And of course, there could be some challenges for you to recreate the entire services in the house, in the home atmosphere with caregivers, healthcare professionals. So how do you handle all these things from Portea?
Thanks, Madhuri. Thanks for having me here. It's wonderful to be chatting with you now. So from outside the hospital, what we call actually the outside the hospital care is a very, very big requirement from an overall healing perspective, right? I mean, it's like scientifically proven, medically proven that you heal much better at home, right? Because you are with your loved ones and in a more familiar setting, right? After, of course, once you have gone through your tertiary care requirements, you are always best treated at home from a recovery perspective. So of course, this need has been there for a long time, and you see that in developed countries, it has been fulfilled in a very professionally organized way. And India, of course, needed that. That space has been vacant for a long time. And around 10 years back, we looked at that and said how we could create the same world-class healthcare infrastructure which a lot of large hospitals provide to the patients in India now. How could you provide the similar care levels and similar service to the patients outside the hospital? And that's the genesis of Portea. And so basically we are present in around 40 cities right now, served over 1 million patients so far, and of course work with patients on an ongoing basis in multiple care areas, including post-operative care, primary care, chronic disease management, and of course elder care. And as you are mentioning, caregiving is a big part of that, right? So the whole post-operative care for various ailments actually and different rehabilitation requirements is what we have been providing to the patients in the comforts of their home. Yeah. So that's how that has been Portea's journey. And of course, from a people perspective, it's a service where you need to have clinicians, you need to have caregivers in the patient's home. They have to be well trained. They have to be, of course, not only trained from a medical perspective, but they carry out all the requirements from a patient's need perspective. They also need to be very well trained from empathy, from compassion, from working with patients like their family members, right? And many of our patients call us as their extended family members, right? I mean, we get so many feedback messages where patients say that my father's life went up because of your caregiving, or my father had or my mother had her last few months in a lot more comfort and at ease because of your people being there, right? So those kind of feedback we get regularly, and it's the important part of that whole caregiving is also to have the right empathy, right connect with the patient's family. So training is not only needed from a medical perspective, also from a the core caregiving principles perspective as well. Yeah. And that has been, I would not call it a challenge, but that has been a big focus area for us. How do we make sure that we put patient as the center of our universe and patient as the center of all our caregivers and nurses and medical professionals perspective as well. And that's something which we focus very, very strongly as an organization.
Yeah. And you just mentioned about the skills, about the training and all that. And you also mentioned about the feedback you receive from people. And at this point, I think I just can't help sharing my feedback for Portea. This is a wonderful opportunity for me because we also availed the services for 2.5 years, and till my mother passed away recently 2 months ago. So this has been an eye-opener for me, because the two caregivers were living with me and my mother, and my family has seen, how it was helpful for us to have them with us. And very rightly, as you said, this empathy, cultural sensitization, and we also taking care of them from our side because they come from so many parts of India. We had 13 people in the entire, 2.5 years. So I've seen people coming from Bihar, from Chhattisgarh, from various places. And we also had to, make few changes in our lifestyle and, have them with us. So once again, thank you so much. And then I see that from the other side, because I founded NSN, National Skills Network, to create awareness about skills and vocational training. And Portea has been, helping a lot of DDU GKY students, especially in the bedside assistant and the nurses kind of roles in various cities. So maybe you can tell us a bit about how you source them. And we are aware that they get, also social security through their pay, and also some other things that, you might be doing. So is it like when they come from these training centers, are they productive from day one? Do you just place them in homes, or is there a training that you give? So how does this model work?
So from our perspective, we work with all the National Skill Development counseling partners, actually, council partners, and we work with their various centers in different locations, as you are mentioning. And it goes like any campus placement equivalent. We'll basically do a pre-placement talk, and we'll try to interview them, do some basic assessment, not only from medical skill perspective, also from their readiness to be in medical industry, right? That also is very important part of it. So I think we do the assessment for them, and then post that they get selected and they move to our centers, and they have a specific 10 to 12 days of training after that, where we train them on specifics on how to work in Portea, how to work from a home care setting perspective, because many of these people, when they get trained basically around how do they around medical care, more from a hospital setup perspective. So with us, they of course get trained on how they can also work from a home care perspective, how to use our application, and so on and so forth. So that's around 10 to 12 days of training session, and then of course they get certified after that, and then they get placed in different patients' homes. And after, also on an ongoing basis, we continuously work with them to get them trained on the job. For coordinator has to go to the patient homes many times for upskilling, or if they have to come out and do the classroom training again with us, or if you have to do video training for them, all of that we basically work with them on an ongoing basis to train them, actually. So.
Yeah, and also Portea offers services like, a home hospital kind of a setup, the complete care, which goes into advanced level. So there could be few challenges that you face, right? So what are some of the challenges, mainly from training and skilling perspective, and how do you address them? Like I'm looking at roles like, a senior nurse maybe, or a technical attendant, or like you set up an ICU kind of a unit in the house. Yeah.
So when that's a fair point for all the critical care patients, especially patients who are discharging from ICU for either end of life care or for the rehabilitation. We set up the complete ICU setup at home, including the ventilators and so on and so forth. And that is a complete range of the comprehensive package which we have to create for the patient, which will include a doctor availability, which includes a senior nurse round the clock at the patient homes, the full set of equipments for them. And there the whole, I would say more than challenge, I think the SOPs are a lot around how do you work with the patient and patient's family? How do you keep the whole emergency care as a backup available for that? How do you work with the treating doctor? Because in this case, the doctor who treated them first in the hospital, their concurrence, their active participation also in this becomes very important. So I think the care levels in that kind of scenario is a lot more comprehensive, and that's how we build. So there, I think the uses of technology, the availability of medical expertise, of course, the right set of treating clinicians, right? Like as
Yeah.
you are saying, nurse. So if I'm doing tracheostomy care, if you're doing Riles tube feeding, if you're doing any of those high-end cares, you also need to have well-trained, well-experienced nurses to be available with the patient. So I think there, the comprehensiveness of care, the continuum of care becomes very important. How do you work with patient every day? How do you collect data? How do you basically coordinate with the treating doctor to make sure that we are continuously tweaking the treatment plan as required? So I think it's very involved, very intense level of care which you have to provide during that time. And there I would say that medical expertise becomes very important.
Yeah.
And that's what we very strongly focus on from a training perspective. Also there, a senior nurse will be available from the central team all the time. Coordinator, who's also a senior nurse himself or herself, will be available to visit patient as required. A doctor from our end, the treating doctor, will all be working together to make sure that we are providing the rehab in the best way possible to the patient at home.
Okay, so I'm sure this is going to really be helpful to many people. Like you said very rightly in the beginning, at home there is also the advantage of the emotional connect which happens right with the patient, so the recovery could be faster. I'll just come back to this and the need for skilling that you were mentioning, and helping a lot of girls, especially from rural areas, to get placed in this and in the caregiving sector. Now, a couple of things are observations which I would like to share. Over these last 2.5 years, I have seen at least there were 3 girls who were graduates, and they were very keen on pursuing their higher education or doing something better. Whereas some of them, we could see that for them it was a stopgap. They just wanted to earn some money and maybe experience the city life and then go back to their places. So they all come with different ambitions, reasons, and purposes. So how is the attrition rate here? And do you also have plans to help these girls build a career? Maybe let's say from my house, from my home, they had gone to a different home. Like after my mother passed away, they were sent to a different setup. So like this, the house changes, the atmosphere changes, and they continue to get some experience, but it is still at the same level. Now let's assume they want to climb the career ladder and do something more. So are there opportunities for them through training or through any other initiatives?
Yeah, sure. Actually, I think we have all the possible opportunities for them from training, upskilling, and of course, professional growth perspective. I think given we have been in this, we have been building this for last 10 years, and we've trained thousands of people in this.
Okay.
So this also is becoming more and more viable career option for many of the people, and especially the young girls who come from villages, and they're very heartening stories for many of them, right? Because I mean, a girl gets employment, it changes not only her life, it also changes the whole family's life back at home also, right?
Yeah.
And of course, they become role models in their villages in many ways, right? The fact is, it is a very it's a job with very high dignity, right? I mean, you have a chance to make difference in somebody's life, right? With some of these girls and people do the work which the own family members are unable to do, right? So that's something which is which is very important. It's so very job satisfaction in that sense is very high, and of course dignity is there compared to a lot of other roles which they would have done otherwise, right? So that is something which is there. So we have career options for them. So upskilling their opportunities as well as career options in basically 3 areas. One is that anybody who want to be an administrator as they go along. So some of these people start and then they, of course, they want to become the team leader, team supervisor. So if they have spent 2-3 years, they have opportunities to become the team leader for the next set of people who are coming, because we have large number of the teams out there in the field serving patients. So we require administrative staff who will work with these caregivers as well as the families. So we have team leader positions which they can move towards. We have opportunities for them to become more subject matter experts, or they can also take higher end care like dementia care, like Parkinson's care, right? So there the care level, caregiving as well as the compensation is at a better level. So some of them basically graduate to becoming complex caregivers or high end caregivers. You could say that. The third option is that some of them are looking at upskilling themselves with nursing and other opportunities. We provide opportunities for that. as much as possible from that perspective. Some of them become trainers themselves for next set of batches. In fact, the chief recruiter for caregiving in Bangalore today is one of the caregiver herself, actually, who joined us 3 years back. So she's managing the whole recruitment piece for it. They become role models to go back to those villages. They talk about themselves and how they have grown over here. So so we have moved a couple of people in human resources function in Delhi. So they start working on the human resources function on the backend side. So all the opportunities on the administrative side, subject matter expertise side, is available to them to basically build their career. And also, of course, it's a win-win. Basically, it's a growth for them, and of course, also it's a very good place for us to retain the experienced people to build the organization further. And many of them, to be fair, at least 30 to 40% of them want to continue to be the caregiving thing. So they enjoy that. They believe that's what they should do, and they continue to do that. So as you said, some of them go from home to home. They're happy doing that. I mean, they believe that, okay, this is what I want to do. This is what I do for the rest of my life. They do that, actually. So that's something also. So all options possible for them. It's in our interest to provide them the best of the opportunities to build their skills and grow in career, and we provide that.
Yeah, and also I came to know from a couple of girls who had come from, I think, Chhattisgarh and Jharkhand or one of these states, that their families, and I think these girls were from tribal background, and they told me that their families feel more safe if the girls are in the healthcare and caregiving kind of a sector than going to some retail or any other job in the city. So yes. I think that's a validation here. Yes. Yeah. So then one more important point about the evolution of this industry, I think, is to do with COVID also, which was a big, milestone for people to, look at in terms of the evolution of the industry. So how do you think COVID-19 has helped, or rather made it even more challenging or demanding for you to offer your services? What were some of the learnings, mostly in terms of making it technology enabled? Perhaps I see that as one of the important disruptive elements here in home healthcare. So maybe you can tell us a bit about that.
I think COVID has basically made it more well-known, saying, or much more central as a service. I think before that, of course, home care was something which everybody wanted to use, and all the ecosystem partners wanted to offer. But people during COVID, especially both wave 1 and wave 2, saw massive impact that it could make, actually. So wave 1, of course, when we didn't know what was COVID all about, and elderly didn't want to come out of the home. So all the home care services, especially cancer patients and other serious patients, the home care, the care could be provided in their homes, right? So that became a very, very big positive. Wave 2, of course, was very big from an oxygen need perspective. And especially North India was impacted very, very severely. So providing oxygen therapy at home, providing patient care at home when the beds were totally occupied in the hospitals. I think so. Home care became a lot more well-known offering during COVID. In fact, insurance covered home isolation as part of the insurance. It became part of the insurance policies. And even now, certain insurance companies are looking at how they can start covering home care as part of their policies, right? So home care became a lot more central after COVID, and now a lot more ecosystem partners today are looking at how they could leverage home care to be much better connected with their patients, right? So that's something which is very important now, and we are seeing impact of that. And you are absolutely right. Uses of technology became a lot more important. Can we use point of care devices more? Can we have connected care much more than what it has been in the past? So people's acceptance of using technology from a healthcare need fulfillment perspective improved also significantly. So we are seeing the technology uses in 2 areas now very prominently. One, of course, are patients a lot more open to using point of care devices? Answer is yes. Are they up for continuous monitoring more than ever in the past? Answer is yes. And second, even this became like accessing healthcare using technology, also being connected using technology, right? So our own clinicians doctors, their ability to use technology became very important, became a lot more prominent now. So how do we collect patient data now? How do we use the data to analyze better and create more customized care plans for the patients? Those kind of things also have improved significantly.
Okay.
So that the whole digitalization of the piece, whether you see it from clinician perspective or you see from patient perspective, has increased significantly, and we see a lot more action happening in this in the next 2 to 3 years.
Yeah, so that shows that it has really had a very positive impact and contributed to the development. Now, before I close this conversation, as an industry leader for you, for Portea, I would like to know a little more about how are you helping the ecosystem evolve around, home healthcare services. Mainly, by, let's say, helping people know about this service. And also another important thing is why people go to branded services, as we know, is the trust we get. We want to be sure that the person who's going to live with us in our homes is trustworthy. And that's what we feel we get from you. But then the ecosystem also has to evolve. There have to be many more things that need to be done. As I started this conversation by telling you about this ILO quote, that there is a need for greater investment in care services. And also apparently it's going to create some 300 million jobs globally. And India is a potential, skills capital for all these people, the human capital, I would say, which can go from India in terms of global mobility. So in this backdrop, what are your, observations and your plan and roadmap?
From our perspective, I think one thing which has defined us as a company is the innovation. So we have continuously looked at how we can innovate from a healthcare, especially from home healthcare perspective, whether it's patients' requirements, whether what kind of services and medical equipment and other things which could provide to patients at home. We have continuously looked at what do patients require, how can they support them at home in a more comprehensive manner, and that's what has helped us to continuously support patients and build the organization. And we want to do that in every area with every ecosystem partner as well, whether with the hospitals, we look at how we can create the care continuum for the patient, whether it's with insurance companies, pharmaceutical companies, with skilling organizations, with NSDC, everywhere we look at how we can innovate to the next level along with them, how we can create more solutions for the patients, how can we create more solutions for the ecosystem. And I think that's something which you want to pursue with. I think that's something which we look at, how can we launch newer services? Can I do hypertension management at home? Can we look at, of course, ICU care we talked about. Are there other areas in which we can continuously evolve and build solutions for the patients to be treated with more ease at home, actually? And that, I think, has been our guiding principle. And just we want to make sure that we retain that DNA. The whole innovation piece, creating new solutions across the board, is something which we want to build. And so even with the skilling perspective, we want to do that. How we can today, when we do this training for people, can we do online training for people when they are in their own centers, right? Can we do remote training? Can we do a lot more remote management, remote support for these people? Those kind of things which we are looking at more and more, where we can leverage technology and work with different partners. So I think that's a guiding principle for us. The innovation is a guiding principle for us.
That's really nice to know. And also your plan for, including more and more people through training, because the industry has a huge potential. So thank you so much, Mr. Vaibhav, for sharing the Portea story with us today. And with the family structure changing and all that, I'm sure going ahead, most of us will need more and more people to help us when we grow older, perhaps, because as we say, for our parents, we were there, but for us, we don't know who's going to be there. I'm sure Portea will help us a lot there. Thank you.
We are here. My pleasure to talk to you. So.
Yeah. Thank you.
Thank
Bye.
you.